Hi everyone, welcome back to PrettyWell. Dr. Angela here with you. In this video, we're gonna focus on SIBO, small intestine bacterial overgrowth. And so what SIBO is essentially a colonizing of bacteria that are oftentimes found in the lower intestine, normal flora, but that have set up shop in the upper intestine and in large numbers. And then what happens is we can become symptomatic. The most common symptoms that people experience are bloating, abdominal distension, pain. A lot of times people have just excessive burping happening. Sometimes there's flatulence. Sometimes there's changes in transit time. Diarrhea that just keeps coming on and people can't figure out. Sometimes there's constipation that's happening. Sometimes there's alternating diarrhea and constipation, and there can be other symptoms as well. And I'm gonna put a wonderful SIBO resource website in the description box for you guys to just have a look. If you're questioning whether or not you might have SIBO, if you're having a bunch of questionable symptoms, you can look at the extended list because there's many. But the most common symptoms that people tend to have with SIBO are bloating, feeling pain. It's usually like you wake up in the morning and you're okay, and as the day progresses, symptoms get more intense after meals, because what's happening is these bacteria that have set up shop living in the upper intestine, they are fermenting carbohydrates that we're eating throughout the day, and then it's becoming worse and worse in terms of symptoms because of the gas production. The distension is more intense as the day goes by for most people. So that's what causes a lot of the discomfort, and then again, like the irritations that are happening. There can be other underlying reasons why people have those symptoms as well, but often SIBO has not been tested for. And so, if this has been a symptom picture you've been dealing with and you haven't been able to figure it out and you haven't tested for SIBO, it's something to really think about. And it's actually very easy to test for SIBO. Some doctor's offices, like gastroenterology offices, typically will test for SIBO, but more and more commonly now, I certainly give my patients kits to do at home. Many integrative medical doctors, osteopathic doctors, acupuncturists, chiropractors, depending on areas of focus and practice. If anybody's doing kind of GI work, kind of looking to help patients address any chronic gastrointestinal symptoms, typically they will offer SIBO testing in their practice. And so they're just little kits, like I said, that you take home. You do a prep diet for a couple days, and then you drink a type of sugar solution that the microbes living in the small intestine have a field day with, and they make a lot of gas, and then it's uncomfortable, and then typically there are more symptoms for the few hours / the day of that you're collecting for that test kit. But so the gas are fermenting the bacteria are fermenting the sugar solution that was taken in, and the gas is being collected in glass tubes, and then that's sent back to the lab to analyze. And it's actually really important to do testing because we can have different kinds of microbes living in the upper intestine, and they can make different types of gas. And so the different types of gas are what's being tested, and the amount of gas produced is what's being tested, so that how extreme the situation is being captured in those glass tubes. But treatment will really vary depending on if we have one kind of SIBO, another kind, a combo kind. So it is actually important to diagnose a specific type of infection we have and the severity of the infection. That really helps us think about the course of treatment, how long it's going to be, if we're going to need to repeat the treatment. So types of treatment, there are options, and really deciding is going to be based upon what the history was. Like we'll talk about, risk factors, like who gets SIBO and how come. Thinking about what you can actually endure, because some treatments are easier for certain people than others. Just kind of, and then, the type of bacteria we have too. We've got to think about say, if we're doing the herbal antibiotic treatments, there's different herbs that will work on certain microbes. And likewise, if you're doing prescription antibiotics, you might need to do a combo therapy if you have more than one type of SIBO. So, backing up a second, like what are kind of the overview categories of treatment? We can do dietary treatments. And so in that category, there is physician's elemental diet, which is a powder that gets made into a drink. And so it's essentially a liquid diet for 2 weeks, which for most people is a little bit, difficult. It's hard to restrict that much. It's very effective. All of these treatments are effective, but the physician's elemental is very effective because you're essentially starving off any substrate for the microbes for a couple weeks. But it's a challenging treatment for some of us to just do a liquid diet with no other food for 2 weeks. And if somebody's already underweight or malnourished, that's probably not going to be the best treatment choice for them. So really deciding on which treatments for which person, dealing with the diagnosis. So we have physician's elemental diet. We have low FODMAP / fusion of low FODMAP with specific carbohydrate diet. And that is a very effective diet. Oftentimes we do that for longer periods of time, say 2 to 3 months. It can also be used post-treatment for several months as a maintenance phase to really try to prevent recurrence. And I will definitely put a link to a couple diet options in the description box. There are antibiotic and prescription medication options, things like Xifaxan and neomycin. Cost can be an issue. Sometimes it's pretty expensive in the US to do Xifaxan treatment, and so some insurances cover it really well, some don't, and so that can be something that limits that choice for some people. And then herbal antibiotics, very, very effective. Sometimes, swallowing so many pills for some people is difficult because usually we have to ramp up the doses several times a day. And then if there's combo infection types, we have to do broader approach. So, more than one herb, typically 2, 3, depending on what's going on, or combo formulas. And sometimes we do herbal antibiotics for longer periods of time, like 4 to 6 weeks. And so, again, it just is really about which treatment options seem like they resonate for us, like what we can actually follow through with. They're all effective, but if we don't follow through with the treatment, then that's not so effective. So it's just about, deciding who we are and what makes sense for us with our lifestyle, what we can handle, our other health circumstances, to just be really thoughtful that we are being mindful of kind of the big picture when we're all thinking about care. Okay, so backing up a second too, what are some of the underlying risks for getting SIBO? Quite a few. Some common things that people don't think about. Certain medications, acid blockers are really common because if we're on acid blockers for long periods of time, our stomach acid helps us keep down the number of bacteria that are going to be seeding or have an opportunity to seed in the upper intestine. And so innately having low hydrochloric acid or being on prescription medications that lower hydrochloric acid, like proton pump inhibitors, and especially over long periods of time, that's a big risk factor for developing SIBO. Certain other medications like NSAIDs, other chronic antibiotic use because it wipes out our good flora, and then other bacteria have the opportunity to take up shop. But also usually there's something going on with it's called the migratory motor complex. There are these little kind of like intestinal brooms upstream that just help move the bacteria normally downstream. So oftentimes something is going on with those guys, which allows bacteria to colonize in the upper intestine where they really shouldn't be hanging out. So sometimes there are structural reasons as well that there's issues with not having as much motility in the upper intestine. Sometimes there's scar tissue called adhesions from prior surgeries. Sometimes there's issues with the ileocecal valve or diverticuli. A lot of interesting things that can set us up for having structural issues as well and motility issues. We can also look if we've traveled, traveler's diarrhea or getting different types of microbial exposure while in a foreign place, that can set us up for a SIBO infection. Food coma is actually a really, really common risk factor for SIBO as well. And then there's a whole bunch of other health conditions that can set people up for increased risk of SIBO infection. And you'll find that in the website, letting you guys know, is a great SIBO resource website. So, it goes into all kinds of, common risk factors, common associated other illnesses that can raise the chances that we might develop SIBO. So interesting to take a look at if you're suspecting, but definitely going in and having a conversation with your local integrative doctor or naturopathic doctor, they can definitely help you figure out if you might be somebody who might think about taking a test to figure out exactly if that is what's going on, and if it is, what type of SIBO, so that you can get treatment to help it resolve. I hope that was helpful. Anyone who's had SIBO in the community, who has experience with treatment and wants to share their journey, please do. If you have additional questions that we didn't touch on in this video, let me know. Let Dr. Patty know. We'll definitely try to get to those questions. And others of you, when you see questions come in the community, please, if you have answers, chime in and keep the dialogue going. And then please let Dr. Patty and I know what other content you'd like for us to work on creating for you this year. Hope everyone is doing really amazingly, really healthy and well. We're so grateful to have you here with us. Looking forward to seeing you back here soon. Take wonderful care, everyone, and thank you for being part of the PrettyWell community. We love you.